People with lower back pain know that they need a strong core. As a clinical physical therapist, I have seen countless low back pain patients doing core exercises that are way too complicated for them, or way too heavy, or don't address the real issues, and in the worst case, this makes the pain worse or prolongs the pain period. But by the end of this video, you'll know exactly where to start and what to do so that you get your abs supporting your spine again like they were always meant to do. Hi, my name is Markus, I'm a physical therapist from Finland. If you're bored, you can skip straight to the first exercise, but briefly on why you need strong abs for a good and healthy back and pelvis. You have several abdominal muscles, you have external oblique muscles, internal oblique abdominal muscles, you have the transverse abdominal muscle is the deepest layer of ab muscles, and then you might even consider pyramidalis muscle as an ab muscle, and also then you have the crown jewel, the one that everyone likes, the six-pack muscle, rectus abdominis. If you have weak obliques, weak rectus femoris, your spine starts to arch, your low back starts to arch more easily, you get hyper-lordosis and anterior pelvic tilt more easily, and it is harder to reverse this position, and if you don't reverse this position enough, it starts to strain your spine and your muscles and the tissues in your lower back. And also weak obliques allow excessive rotation from the spine and also side bend from the spine, and if it's excessive enough and repetitive enough, then this can also lead to strains and aches and pains to your spine and your low back muscles. And your transverse abdominis muscle controls and stabilizes your spine and your vertebrae. Next, we will show you how you can stabilize your low back and pelvis, and there are several entry points for different people, so pick the exercise that you can perform with a good form, with a good technique, but is difficult enough so that you have to concentrate and focus while you are doing the exercise. It's all about balancing the difficulty and the form. Before you begin to do this exercise, if you have had an acute injury to your spine or pelvis or in your abdominal region, then consult your medical professional before you do this exercise. This is the easiest version, and people with really bad backs often have to start with this one. But don't be afraid if this looks and feels too easy for you. Your version is yet to come, so stay tuned. So for this one, lie on your back, both legs bent. Now twist your low back against the floor. So posteriorly tilt your pelvis. So push all the air out between your low back and the floor surface, or whatever you are doing this on. If you can't do this, the posterior pelvic tilt, then you might have to check this video out first. There's a tutorial for this, so you'll learn how to do it. Okay, then put your fingers to the side and poke your low back to see that it is glued to the surface. And now start to slide and straighten one of the legs and keep the other one put and your low back glued to the floor, and then pull the leg back. And then do this with the other one. You can do it alternating the legs, or then you can do it with one leg 1 minute and then with the other leg 1 minute and then change again. If your shoulders are super stiff and you can't get your fingers besides your low back, then you can do this one. Put a rubber band, resistance band under your back and keep it there with the pressure of your back against the floor, and then if your back starts to arch, then it snaps out under your back, so you know your back started to lift and arch. Do this exercise 2 minutes, and if you feel that your back starts to peel off, this means that you need to stop the exercise. You have done enough for the day. And start doing this daily to get fast results. 5 times a week is also good, but if you want to get results and fast, then do this 2 minutes every day. Now the next one is the same. Everything is the same, but you lift the other leg up and then lower it down straight if possible. But if not, then you can lower it down knee bent. Again, check that your back doesn't go up. Do this daily. Use your friend the resistance band to tell you the cold, hard truth if you can do this or not, and do it 2 minutes or even more if you want. Why not? And this is better to do 1 minute with one leg and then another minute with the other legs. Do this one leg at a time. Next entry point or progression point is both legs up, and this will start to become hard. Now turn your lumbar spine against the floor, opposite hand against the opposite knee, keep the hand straight. This prevents you from cheating. If you have your personal trainer, the resistance band there, then the merrier. Now start to lower your leg, touch the floor at first with the knee really bent, and maybe even a slight touch with the toes at first. Do this 30 seconds per side and then other side. Remember to keep your opposite knee from coming closer to your chest. This is why you need your hands in this exercise. Slowly, when you develop the coordination and the muscle strength, you can start to lower your leg more straight, like this. And in the final form of this version, lower the leg really straight. You can also add length, so you can do this 1 minute per side or 2 times 30 seconds or even longer if you can. Now to the final form of this exercise. You lower your legs both and your hands while keeping your back glued to the floor. Now this is really hard, and it's really hard to resist the urge to arch your back. It's like the temptation of the fruit in the garden, but you can resist it because you have slowly tamed your appetite for the lordosis and your abs are getting sick strong. Now in this, you can take this even further. You can grab a weight in your arms, in your hands, and this is the final boss of the dead bug moves.
It's time to kick ass and chew bubble gum, and I'm all out of gum.
This one you can do 2 to 3 times a week because it's really heavy, and do 2 to 4 sets for the best results. If these exercises were hard for you and you have had challenges with your overarching low back or anterior pelvic tilt, then it's muy importante to release your hip flexors. They are a big part of the puzzle. Then this is the best way to release your hip flexors, put it in your spine health program and get better. Heaps!